My name is Brenna Lepkowski, and this is my business review. My dream is to become a doctorate-trained pediatric nurse practitioner within the Child Advocacy Resources and Evaluation Team clinic at Cook Children's Medical Center in Fort Worth, Texas. The care team serves an urban population serving 6 county areas around the city of Fort Worth. It is a private specialty clinic, a part of Cook Children's Medical Center, located in the Dodson building of the hospital campus. The clinic operates with 3 physicians, 4 nurse practitioners, 2 of which are doctorate of nurse practitioner, 7 forensic nurse examiners, 1 care partner, and 2 social workers, as well as an office coordinator, and 1 educational coordinator, and a therapy dog. Clinic hours are from 8 a.m. to 4:30 p.m., Monday through Friday. The need for this clinic is showcased by a recent study which concluded that nearly 34,000 children have been abused either physically, psychologically, and/or sexually. The care team is dedicated to providing safety and promoting health for the children they serve. The clinic is led by board-certified child abuse medicine pediatricians and nurse practitioners. The clinic offers medical evaluations, SANE exams, psychosocial assessments, drug exposure evaluation, and education on preventative health. Examinations typically occur due to suspicions of sexual abuse, physical abuse, neglect, drug exposure, or medical child abuse. Many of these occur as a referral from CPS or Child Protective Services, law enforcement, or a medical provider such as an emergency room doctor, physician's assistant, or nurse practitioner. The clinic also offers community education to law enforcement, CPS workers, and health professionals on signs of abuse and neglect. Training is also provided to community organizations targeting related topics. Training encompasses the period of purple crying, sexual abuse prevention, sex trafficking awareness as a collaborative effort with Alliance for Children through the Stewards of Children Darkness to Light initiative. Education is aimed to prevent abuse, increase recognition, educate on how to foster communication, and aid in the child's healing. As of July 1st of 2023, Fort Worth has 956,709 individuals across 359 square miles. Of this population, 27.3% are under the age of 18 and 7.6% are under the age of 5 years old. To serve these individuals, there are 4,940 nurse practitioners as well as 270 pediatricians. The average household income annually in Fort Worth is $67,927. In Texas, this average decreases to $67,321. However, the national household income is higher with an average of $69,021. The Advanced Practice Registered Nurse focuses on family-centered care. The APRN takes special consideration to cultural sensitivity for the pediatric patients across many different healthcare settings and disease acuity. The pediatric nurse practitioner works as a member of an interprofessional team in order to provide evidence-based care to children with illnesses and various stages of organ dysfunction over the ages of 0 days to 18 years old. They are responsible for independent and clinical judgment and collaborative decision-making for the patient's care plan. The pediatric nurse practitioner monitors and ensures the quality of health care provided to the pediatric patient and their family. The PNP further assists the patient and family in navigating current care plans and the need for follow-up appointments. The expectations for this work environment require 40 hours per week for full-time. They require that you participate in medical evaluations of patients within the emergency department and the clinic for signs of abuse or neglect, as well as working as a liaison to CPS and law enforcement. They require that you are a graduate from an accredited nursing institution, have a minimum of 2 years as a registered nurse in direct patient care, you have a license to practice in the state of Texas, recognition from the state board as an advanced practice nurse, as well as a certification as a PNP, which is a pediatric nurse practitioner, or an FNP, a family nurse practitioner. The national average of salary for a pediatric nurse practitioner is $119,555 annually. Across Fort Worth, the average is $111,381 annually, and for Cook Children's employees in the care team, it is $119,855 annually. As a full-time pediatric DNP of the care team, one would be requested to be in office for 40 hours each week between the hours of 8 a.m. to 4:30 p.m., Monday through Friday. This role will also request on-call time for coverage of emergency cases, typically from the emergency department. These hours vary based on monthly coverage and physician availability. Typically, on-call hours include 1 day each week, 1 weekend per month, and 1 major holiday and 1 minor holiday. Malpractice insurance is required for this role and is covered by Cook Children's Indemnity Company. As a DNP PNP, you are granted $1 million per claim and $3 million for the annual aggregate. Cook Children's Medical Center offers several benefits for those working in the hospital and specialty clinics. Several plans for insurance are offered through Aetna to cover medical visits, prescriptions, dental, vision, and teledoc appointments to all full and half-time employees. Cook Children's also offers basic life insurance at 3 times the annual salary. Disability is offered for short-term and long-term leaves of absence. Short-term disability is offered to full and half-time employees with 1 or more years of experience and begin after a waiting period. Long-term disability offers 50% of the base salary beginning 6 months after the disability date. These are both offered for a maximum benefit of $10,000 per month. Cook Children's also offers paid time off, or PTO, that is accrued for each hour worked, up to 80 hours of pay period, which is every 2 weeks at Cook Children's. Full-time employees are given 40 hours to front-load their PTO when they are hired on. Additionally, retirement funds are collected each pay period based on the individual's contributions to either pre-tax or Roth savings into a 403(b) account. Cook Children's will then match contributions between 4 to 7.5% of pay into a 401(a) account if equal percentage is contributed to the 403(b) by the employee. Cook Children's also encourages further education by reimbursing tuition up to the IRS's non-taxable limit after working for 6 months as either a full or half-time employee. Each day as a member of the care team varies due to the patient volumes in the emergency department, the number of children in foster care, the rate of outcries of abuse or neglect that a child makes. Each provider in the clinic continually accepts new patients to either the foster care clinic or the care clinic for SANE exams, psychosocial assessments, and forensic interviews. Since the number of cases varies each day, a 2018 survey was used to calculate the average number of patients seen each day. This number came to anywhere from 11 to 20 patients a day. Calculating the low end of the average tells us that our provider may see 1.375 patients per hour during an 8-hour clinic day. Cook Children's Medical Center and the care team receive reimbursements for treatment from Medicare, Medicaid, CHIP, which is Children's Health Insurance Plan, and commercial plans. Medicare reimburses nurse practitioners at a rate of 85% of fees and services. Medicaid and CHIP reimburse the nurse practitioner at a rate of 70 to 100% of fees of services, and the commercial plans reimburse based on the fees of services, a capitated basis, or a combination of these two. Medicare and Medicaid services offer the patient and family full coverage of funding for care team appointments. The minimum cost for an out-of-pocket visit is $301. These costs can climb to $1,266 for a more in-depth appointment. Should the family pay out-of-pocket with no insurance, Cook Children and the care team offer a 25% discount off of the costs. For these calculations, the median of 11 patients and 20 patients seen by a clinic provider each day was utilized. This was rounded to 15 patients. With an average of 15 patients seen each day for care team visits, the provider will make a gross revenue of $612.40 per visit. This was calculated by finding the sum cost of appointment visits with the care team, which totaled $3,062. This number was then divided by 5 to give the average cost of $612.40 per visit. Reimbursed at approximately 80%, the advanced nurse practitioner will take home approximately $489.92 per visit. This number was calculated by multiplying $612.42 by 0.8. Expenses at the clinic do not come from the nurse practitioner's paycheck, but are instead covered by Cook Children's Medical Center, as the healthcare setting is a not-for-profit organization. This includes medical supplies, laboratory testing, office expenses, and equipment repairs. What is taken from salaries are federal taxes, retirement funding, and medical insurance, which are based on the personal preferences of the nurse practitioner or staff member, as well as the income rate. A doctorally trained nurse practitioner for the care team at Cook Children's may work in collaboration with Child Protective Services or CPS, members of law enforcement, emergency room physicians, physician assistants, or nurse practitioners, or the nurses as well. A nurse practitioner in the care team is evaluated based on a structured review system which considers income evaluation, peer reviews, patient ratings, patient ratios, adverse events that occurred during their care, and physician reports. These evaluations occur quarterly typically, as well as needed self-reflections or evaluations with the physician they're paired with. Thank you for watching. Here are my references. This is page 2 of references, my final page of references.